When the current crisis began in 2003, humanitarian organizations responded with the largest and fastest emergency response in memory.
Assalamu alaikum. Ahlan wa sahlan. اسمك?
I was here in early 2004 with Save the Children and had a chance to speak with these mothers in Riyadh camp who had just arrived and were living in shelters made of little more than sticks.
In 2004, we had a massive emergency, and as a result of the emergency, there was an enormous reaction from the international community. 13,000 humanitarian workers came in, and we made a real difference.
Health clinics and refugee camps were established throughout the region in order to serve the displaced. Giant Antonov aircraft dropped food in hard-to-access locations cut off by rebels, militias, and bandits. These women told me that without supplemental supplies, they had too little food to even make breast milk. Massive food distributions like this one at morning camp kept hundreds of thousands of dying from starvation. Now, 4 years later, amid the continuing violence, aid workers are seeing the impact their work has had.
I think if you go back where the situation was when the humanitarian operation started in Darfur, it was horrible. I mean, it's again beyond anybody's imagination. And now, I mean, 2 years, 3 years, I mean, the humanitarian support has made a very positive contribution to improve the situation. So I think satisfaction is huge.
In camps and clinics across the region, doctors measure their success. Ali Dalbait is a Sudanese doctor working for IMC. Dr. Ali's choice to remain in Sudan and help the people of Darfur gives him immense personal satisfaction. In many ways, he is doing more than saving lives. He is also investing in the future of his country. Looking back over the past few years, Dr. Ali notes the progress of the relief effort with pride.
Figures of malnutrition are almost now going down, although still there's some cases, but if you compare it to the beginning, it's going down. And in terms of health educations, we did a lot. So we managed to control some of the killing diseases like malaria, diarrhea, and that's really a kind of success.
Thanks to the efforts of physicians like Dr. Ali, children, such as 11-year-old Yasser, stand a fighting chance. Much like Rashida, Yasser says he was shot when he left his home to forage for supplies. A mere 5 days ago, he was collecting grasses to strengthen the roof of his home when a group of unidentified men began firing their weapons into the air. An infamous outlaw militia, the Janjaweed, operates in the area. Local authorities say they were responsible. Yasser was shot twice in the leg and nearly bled to death.
When we examined him, he has multiple wounds in the left side. It's like a bullet injury having exit and entry, even with another entry site. And then today when the father is back, he brought him here, he said, for proper treatment because he's seeing the patient is still having pain and is not okay still.
After receiving emergency care at a nearby hospital, Yasser's father brought him to the IMC Riyadh clinic, where doctors administer antibiotics and change his dressings ensuring that he will not lose his limb or be permanently crippled. While the doctors and relief workers are often modest about the successes of their work, the hard facts say it all.
In 2004, if you remember the pictures of children starving to death, those pictures are no longer in the media because we have been successful. We have brought malnutrition rates down from 22% to 12%. We have brought the under 5 children mortality rate below emergency thresholds. There are more children in school today in Darfur than ever before in Darfur. And that's a major achievement.
Since July 2004, IMC has been a lifeline to the children of Darfur and has saved thousands of lives. Serving a population of 288,000, IMC saw over 192,000 patients in 7 primary healthcare centers and 2 mobile clinics in 8 locations throughout Darfur last year alone. But it's not just the number of people IMC has served that has made this organization special.
We bring a lot of hope to a lot of people. Our medical staff save lives every day. When people come to our clinic, they could almost be dying. Moms are bringing their sickest kids in there and they're wondering whether they'll live or not. But I think when they come into an IMC clinic or hospital, they know that there is some hope for their children to actually live.
So what is it that sets IMC apart from other NGOs?
Capacity building is actually one of our core programs because we do emergency response as well as some developmental work. So I think when we enter a conflict zone with that kind of thinking, people are aware that we're not just there to just give them emergency response and then leave, but we're actually doing developmental work because we have hope that their future is a little bit brighter than maybe at the present time.
Okay, now he's 4 months old, having fever. Part of doing emergency is also a kind of development and capacity building, and this is really a kind of different from other NGOs because it's not just to relieve what the emergency people have, but also to think about their near future, what should be done to make them more settled and to have a better life.
Al Jebel Clinic is also located within Janina and is a unique example of IMC in action. Here, doctors, medical assistants, vaccinators, and health educators serve both residents of the city and a population of IDPs residing nearby. This intermingling of the communities helps decrease the usual tension between the groups. On average, Al Jebel Clinic serves approximately 75 to 100 patients per day. For IMC, a big part of capacity building and creating a sustainable future for Darfur is staffing.
There are 13,500 humanitarian aid workers here in Darfur. What may surprise you is that the majority of them are actually from Sudan and are not Westerners. The importance of this is that when organizations like IMC leave Sudan, these local clinics will continue to operate with local staff.
I would say at least 80 to 90% of our staff is actually all Sudanese. We don't have a large expat group here in Darfur. So we do get our motivation from our national staff, we get our dedication from our national staff, and they really help us push our programs forward.
As a Sudanese national, Dr. Ali takes special pride in his work.
Yeah, I'm really happy because I'm supporting my patients here. So I'm my people even here. So I'm really happy because I see them smile, and when they finish with the clinics, when they come in, they're really in pain, and mother is crying because her child is sick. When she gets back, she's happy, and that's really give me a great feeling of happiness.
Dr. Ali is not alone in his feeling of pride from the work he does. For young Sudanese doctors still in the early stages of their careers, IMC provides on-the-job training in a field they love.
I'm very happy to work with IMC here because I'm improve a lot of things here. Even in the medicine, we attend several workshops with IMC. So there is a chance for you to improve your qualification, and it's something very nice to work with IMC, as I think.
This type of capacity building and long-term investment is integral to the successful future of Darfur in helping its people return to self-reliance.